Have you ever noticed that joints can crunch? Knee joints, shoulder joints, spinal joints, most often we perceive that crunching is something scary. In fact, there is not always a problem with a crunching joint. In this video, we will talk about why a joint can crunch, what to do about it, and what are the reasons. My name is Mikhail Zbrodin. I am a traumatologist-orthopedist, a specialist, a teacher of the P-DTR method. Let's go. Has anyone noticed, and they come with a complaint? To the reception, I walk up the stairs, everyone hears that the knee joint is clicking, the ankle is clicking, I can't, let's say, sneak up on someone because I'm crunching all over. Is this always a problem? In fact, clicks in the joints occur in adolescence in children. How can a click occur? A person sat down, gets up, the click no longer crunches. The joint does not hurt, the joint works normally. This is not a problem, this is an option. The norm, another option. You walk with each step you have some abnormal sound in the joint. Especially those clicks that are accompanied by pain symptoms. In this case, this is a problem that should be diagnosed and eliminated. In some cases, and you do not hear clicks. But when you put your hand on the joint, perform a movement, you have a feeling under your palm as if crepitations are walking on snow or clicks. This is also a sign of a contribution of hyaline cartilage, the cartilage that covers bone tissue. In this case, this is a sign of arthrosis. Why can a joint actually click? A joint is a hinge, biomechanics, which is determined by nature. But for it to work properly, all muscles must perform the correct movement. Some muscles turn on, others turn off during movement, and the joint works well. But what happens when some muscles stop working properly? Some are overly tense, the joint begins to shift in different directions, if there is a shift even by a few millimeters. This leads to excessive wear of cartilage and clicks appear. Here is how to check if your muscles are working properly. Here a specialist in the P-DTR method will help you. What is the P-DTR method? This is a method that allows you to find incorrectly working muscles, turn them on by searching for the cause of their weakness. When we eliminate it, the muscles turn on, and the joint returns to normal biomechanics of movement. Over time, clicks can completely disappear, or their manifestation will significantly decrease. If you are a patient and it is difficult for you to perceive this information, contact a specialist who will test your body, collect anamnesis, find and tell you the reason why this particular joint is crunching. When you completely eliminate these reasons, then the crunch will either go away completely, or it will. And most importantly, the painful manifestations from this crunch should go away. In this case, the joint will begin to work correctly, and if you are a specialist, for example, you are a stopgap, a chiropractor, kinesiologist, traumatologist, orthopedist, neurologist, doctor, restorative medicine, rehabilitation specialist, I invite you to our free webinar at the link under this video or in the pinned comment, during which I will show you how to perform this testing, how to find, for example, the cause of pain in the shoulder joint or crunching in the shoulder joint, which can be localized in the neck area, in the pelvic area, in the ankle area. You will be interested in watching this logic. I am more than sure, after this webinar, using this simple approach, the next day you will be able to eliminate dysfunction in your patients more effectively. So, when a crunch in a joint can be a serious problem. For example, you have never had clicks and crunches in this joint, but there was, for example, an injury to this joint, and after some time clicks appeared. This is a sign that the joint is not working properly. Secondly, any click, any crunch that is accompanied by pain, is a problem. Other situations, your joint jams, crunches, and after that swelling appears. A lump of fluid in the joint, this indicates that there is some kind of violation. For example, there is a torn meniscus, a torn articular, and during some movement you provoke this damaged segment. There is a sharp inflammation in the joint. This is a sign that you cannot live long with such a joint. It needs to be examined, find the cause to eliminate, perhaps promptly. Perhaps without surgery, a specialist in the P-DTR method will help you. But this is what is an indication for a more detailed examination. Why the joint may not move completely. That is, you, for example, try to raise your hand, it does. not rise to the end. Try to bend your knee, it does not bend to the end. What could be the reasons? If you have a lunge fluid in the joint, then during movement this fluid does not allow you to make a full volume of amplitude, then this fluid must be removed, or prescribe drugs that will promote the resorption of this fluid. Once, if there is inflammation in the joint, you need to prescribe anti-inflammatory treatment. This is done after examination by a traumatologist-orthopedist. But in some situations the hand may not rise due to the fact that there is not enough muscle strength to do this. In this case, as you already know, you can contact a specialist in the P-DTR method, who will find and eliminate the cause of these weaknesses in your hand. And sometimes even during the appointment it will begin to move completely. One clinical example, here are the parcels here, please look. At our channel, we are analyzing a patient whose hand had not been raised for 15 years. Literally within 10 to 15 minutes of working with him, we received a full range of motion. This is what a specialist in the P-DTR method can do. This is what you can do as a specialist who will undergo training in our P-DTR school, and we will teach you to fix these dysfunctions by finding the root cause of everything. What kind of care for your joints is required at any age? The first is full movement, walking, exercise. Movement. 1. This is a complete diet. A certain amount of liquid, vitamins, microelements. This is the absence of excessive overloads of the joint itself, and then your joints with such mobility. They will be lubricated as expected, the tissues will work well, the joint. There will be no clicking, the joint will not hurt, and you will definitely not go to a specialist about this joint. Be healthy, move. Mikhail was booked with you by everyone.